various numbers of people who are at various levels in terms of their ability to provide the kind of work experiences that people would need from this alternative workforce. Let's look at some of the new programs. I think that you have a new program that you're more concerned about today, so that our audience might know more about this program. Let's talk about this new program that you have.
We're real excited about this program. It's called the Adapted Work Service. And as we've mentioned, it is for people who are in the early stages of memory loss, mild to moderate stages actually, and such as Alzheimer's disease. There are other causes of memory loss.
Let's talk about some of those other causes, because I think when we talk about people with memory loss, we think about of a person 70 or 80 years old or whatnot, but are there other persons who might fit into this category?
There are several people who suffer from a memory loss severe enough to have an impact on their daily life, and the age range maybe early 40s, 50s, 60s, and up into the 80s. I'm not a physician, so I could not go into all the causes, but there are sometimes strokes.
Some of the popular causes that are generally associated
some
with
type of a head injury or strokes. It could be a progressive disease such as Alzheimer's disease. There are other types of disease that are more rare than Alzheimer's, but we do need a diagnosis of some type of memory loss, so it should be evaluated by a physician. And several types of memory loss are reversible, which is why it's extremely important to see a physician if somebody's having trouble with their memory. But we try to, look at every person who comes through and see if we can be of help to them.
And so you've got 140-odd people that come through.
Well, now those folks are the folks who attend the regular or the longer established program at Rochelle Center. The folks in our adapted work service are, at this point, we have 7 people. And we would like to get up to 10 people per day.
Well, let's look at the structure of the Rochelle Center so that our audience might have a fairly good idea in terms of how they might be able to assist you in whatever you do there. Now, you're organized primarily as a nonprofit organization, are you not?
That's right.
Let's talk about that and how you see your own organization, and perhaps give us some information that our audience might be able to use to either assist you in what you're doing or perhaps take advantage of what you're offering here this morning.
Okay. Yes, we are a nonprofit agency, and our funding source is our Department of Mental Health and Mental Retardation. They provide some funding for us. We also receive funding through the United Way for our family support services and several other programs. We have the work service that we perform for companies, generates some income, and we accept donations, of course, as a nonprofit agency. And we have a golf tournament coming up in September, actually, which will benefit the new program, too. So we have several areas, but so donations are one of our main areas. And we also have some volunteer opportunities for people, which we're real excited about.
Well, let's talk about some of those volunteer opportunities.
We've had some folks come in and work with some of the clients on planting things, and some on doing some craft type of things. Occasionally they'll go on field trips or that sort of activity.
And so people can become involved from a volunteer standpoint with what you're involved in. What are some of the reactions that you found, Ms. LElledge, to how employers have been willing to receive what you're trying to give them? I mean, what are some of their reactions?
For the most part, it's been very positive. Most people see it as an opportunity for them to, help somebody else, but also help their company and get this job done at a reasonable price. So the reaction, for the most part, has been very good.
So you feel that they feel that there's some kind of social responsibility that is connected with large organizations to perhaps become involved in some of these activities.
Exactly. And then, of course, some look at it purely as a business venture, which is fine, too. And they feel like we did quality work, and they're getting this done in a way that helps them, that alleviates time and trouble for them, so they're happy. So either viewpoint we like.
Now, persons who are involved in the program, do they eventually graduate from some of these programs, or are they under your care permanently, or what? What's the situation generally, Ms. Hayes?
Well, it's a day program. Most of these folks live at home and have for most of their lives. There are other types of opportunities for employment. We do some supported employment and try to make sure that we can arrange that for people who want that. And that's our main point in our program is that people learn and develop the skills that they need to become the best that they can become in a supportive environment. And there are programs in the city that do supported employment, and we make sure that we try to connect them to these programs. Now, with the memory loss program, it's a little bit different because they are less able to develop new skills or maintain skills. We expect to see a little more deterioration in skills over a period of time, in which case we will then help them to transition into a different type of program for the daytime. If that's what they and their families would like. We anticipate that they would. Adult daycare, there are plenty of good adult daycare programs in the city, and we work closely with them. And that is one of our roles, is to make sure that if for some reason either program is not appropriate any longer or not what they or their family wants, then we will help them to go on into something that's more appropriate.
Very good. Ms. LElledge, I think that there's been quite a bit of discussion quite recently in terms of a new mental health program for the state of Tennessee, and I think it has included a number of redirections of some of the mental facilities throughout the state. Let's talk about that for a moment in terms of the impact that at least the projected impact that such a reorganization might have upon the Rochelle Center. Or will it have any impact upon the Rochelle Center?
Well, Sharon, you'd be better.
Well, I don't really know that it will. That is more addressing the issues of people with mental illness rather than mental retardation. I suspect that the trends will also eventually have an impact on our type of program.
Now, you made a distinction between addressing the question of people with mental illness and people with mental retardation. Now, you deal primarily with people who have mental retardation.
That's
now, what
right.
is the distinction, popular distinction for our audience this morning?
Someone with mental illness may not have a cognitive impairment. They may be able to learn things. For example, their IQ might be normal or above normal or below. It's a different type of disability altogether, though it's easy to confuse the two. Mental retardation is a person would have a lesser ability to learn things, or will learn things more slowly than some other folks. But emotionally or in terms of their chemical balance, they're fine. They're like anyone else. Sometimes, occasionally someone has both mental retardation and mental illness, but they are different types of disabilities, and there tend to be separate services.
Very good.